Damien Foundation developed the 9 months regime to treat multi-drug-resistant tuberculosis, trying to find a good balance between tolerability and effectiveness. Dr. Armand Van Duyn, who was in the Bangladesh project, mixed drugs available that were not totally recommended by WHO in order to find a good balance in tolerability and to have more powerful combination. So from a series of combination of regimes that started in 1997 to the year 2005, he managed to find good combinations of TB drugs. Multi-drug-resistant tuberculosis is spread by the air, and bacteria become resistant if the treatment is misused or mismanaged, which means if the patient didn't take the full course of treatment or is not regularly at treatment, or the health worker doesn't prescribe the full length of the treatment or the wrong dose or the wrong length of the treatment, then the bacteria becomes resistant. Also, if the patient has previously had tuberculosis, the risk is higher. And if you live in an area where MDR, multi-drug-resistant tuberculosis, is common, you get more chance to get it. Tuberculosis is spread by the air, which means if a person is speaking, sneezing, coughing, or singing, you can get it from that. And it's not spread by shaking hands, kissing, sharing food and drinks, or sharing toilets or linen beds. First time I was involved in treating multi-drug-resistant tuberculosis was in Burundi. And that time, we hospitalized the patients in the sanatorium. Sanatorium is a huge hospital, 200 beds, that actually started before the discovery of drugs that were performed to treat tuberculosis. So the concept was to hospitalize patients, to have good air, and to have good nutrition and to have good rest in order to cure tuberculosis.
Damien Foundation started treating MDR patients in Bangladesh just under pressure of the nurses there. The nurses and Armand Van Duyn, they were saying, we have those young people there, they failed the first-line treatment, they're going to die, they want to live, they have families, we have to do something. So that convinced us.
There is much of rejoicing at WHO news that endorsed the 9 months Bangladesh regime, because it shows that the work of the health workers committed to treat multi-drug-resistant tuberculosis finally achieved to be recognized by the entire world, and also provide new hope for the multi-drug-resistant tuberculosis patients to be cured and to prevent deaths.
Usually when MDR-TB treatment starts in a country, it's hospitalized. But we see that all these months of hospitalization really make people suffer, economically, socially. So more and more, after maybe some initial hospitalization, countries start going to decentralize it to the community. And even a health post or health center can be too far away for such a long treatment. So the idea is to train community health volunteers, buddies, that can encourage that difficult treatment so the patient continues to take it till the end without having to stay in a hospital or travel every day 10 kilometers to the health center.
So to increase the access to the Bangladesh regime, we need a paradigm shift, which means defeating resistance to change. We were used to treat patients with 20 months regime. Now we have new drugs and we have to develop capacity for this. So first thing is to disseminate evidence that this 9 months regime actually works. Second is capacity building, training health workers. Third is to ensure that we have enough quantity of TB drugs to treat these patients, including formulations for children. The main message for the Belgian population, I think, that its contribution, the donors' contribution, has helped to develop an efficient 9 months regime. So now we are able to cure 90% of persons treated with the 9 months regime. So again, multi-drug-resistant tuberculosis can be cured and deaths can be avoided. That's the message for everybody.